Moving on to other stories, and several eateries operating in the Accra Metropolis still lack toilet facilities to allow them operate as standard food joints. A visit to some restaurants and chop bars raised some pertinent health concerns.
Cholera, according to the World Health Organization, is a disease one contracts after ingesting contaminated food or water. The WHO indicates provision of safe water and sanitation is critical to control the transmission of cholera and other waterborne diseases. Recently in the central region, a cholera outbreak which has claimed 3 lives was linked to a food operating joint. The standard for operating a food joint has been outlined by the Accra Metro Public Health Directorate.
We're looking at a premises that have been licensed to prepare and vend food for public consumption. You must have a kitchen. The walls and the floor must be impervious, must be cleansable. The ventilation too must be adequate. And the dining area, the kitchen, you must ensure that flies cannot access the water source for the dishwashing, for drinking purposes. If any of what I've mentioned gets contaminated with the excreta, that means definitely the food will be assessed or it will get into the food, then we have problem.
The first stop for the new school was at a food joint inside Ridge that served common African dishes. Interestingly, our observation proved the food joint was a favorite, though it operated in a tent structure. At first sight, tables for eating had liquid soaps with covered cups of water, but not everything in the dining area met the standard demanded by the Metro Health Directorate. Operating without a toilet facility for customers, these 2 makeshift structures served as urinals for customers, workers and other inhabitants of the household. The compound space serving as a kitchen had rubbish piles at one end, a mechanic shop at the other, and these yellow gallons serve as water reservoirs for operating the joint. At another popular joint that operated inside a household at Kokomlemle, this is the condition of the urinal that served customers without a toilet facility. Manager in charge at the joint refused to allow the new school capture insanitary conditions of the kitchen. At Adabraka, this food joint operated on a compound without a toilet facility. There is a functional tap water here, but lacks drainage systems to allow free flow of wastewater. This is the dining area for customers, and this corner served as a kitchen. Accra Metro Public Health Directorate Victor Akwe stressed the population of food joints outnumbered health officers, the reasons why some operators are taking regulations for granted.
10 environmental officers to a population of about maybe 300,000 of a sub-metro. But we are more interested in standard enforcement. Because see, the bottom line is not the protection, the bottom line is to prevent the occurrence. So the handler in this sense is very, very also key. For which, if nobody can stand 24/7 and see what practices goes on, to be aware that for any action of east or west can lead to contaminated food.